Created conversation on SAFM.
26 minutes now to 9 the time. Good morning to you. Cabinet is expected to meet today to discuss the Covid-19 regulations which are still in place. Already there's been the leak of a document signed by the Health Minister, Dr. Joe Phaahla, asking health MECs around the country whether they have any objection to removing these regulations. It seems that the biggest regulations that could change are the requirement to wear masks indoors and the continued restrictions on large gatherings. That would mean that stadiums and theatres, for example, can only be half full. But the COVID pandemic is still with us and can still have serious consequences. Look at what's happening in places like China. Look at what happened recently in Hong Kong, for example. So then, is it the right moment to remove these last restrictions? What is the future of COVID-19? Let me put the question like that. Joining us today is Professor Salim Abdool Karim. You know him, of course, as the head of CAPRISA and an epidemiologist. Professor Abdool Karim, good morning, and thank you for your time this Wednesday morning.
Very good morning, Stephen. Good morning to all of the listeners.
Firstly, at this stage, as Cabinet meets to discuss the regulations, is there any need to keep the regulations as they are? Is there a strong medical need to keep face masks, to keep regulations, restrictions on the number of people at mass gatherings?
So, Stephen, when we look at that question, we've got to go back one step, which is that this epidemic in South Africa comes and goes in waves. And that we know that at the end of a wave, we have about a 3-month period of low transmission. And during those periods of low transmission, we get small outbreaks, but we don't really get a huge runaway increase in cases until the next wave. In fact, it's now so consistent that I was able to predict almost to the day when the 4th and the 5th waves would start. So we know we have this 3-month period. And so it makes very good sense to ease the restrictions and to remove most of the existing public health measures during this 3-month period.
So, for example, there was this mass gathering over the weekend. There was that big rugby match in Cape Town. Thousands of people in the stadium. They were outside. Bit cold, but they were outside. Is that a big risk?
So when we look at how this virus is spreading, especially the more infectious variants like Omicron, most of the transmission is occurring in these very small droplets. And there was a scientific study published last week in the Journal of Infectious Diseases, in which they collected the different sized droplets and they looked at the amount of virus in them. And so the viruses have tended to be largely in large numbers in the smallest of the droplets. And so it's really those very small droplets which occur when you speak, not even when you're singing and so on, but when you speak. So in an outside environment, those small droplets are very readily dispersed, just in the normal flow of the air. So the outside environment is actually quite low risk for us. And so that's why you can pretty much go into outside environments without being concerned. It's the indoor environments that pose a problem. It's when you have poorly ventilated indoor spaces and these very small droplets, they stay in the air because they're quite light and they don't fall down to the ground. That's where we have the problem. And that's why ventilation is important indoors, and that's why masks are important indoors. Now, if we're going to ease restrictions and ease the wearing of masks indoors, then we need to be aware of that indoor risk. And there are ways in which you can mitigate that risk. And the principal way in which you can do that is by restricting indoor spaces, for example, public transport, or in indoor spaces where there are large crowds, especially large crowds not wearing masks, that you restrict those to individuals who are vaccinated or who have a negative test, because we know that vaccinated people have a much lower risk of getting infected, and even if they do get infected, because there's some breakthrough infections, they are at very low risk of transmitting the virus to others. So there are ways in which you can mitigate that indoor risk. And if you're still concerned, well, voluntarily wear a mask if you want for your own benefit.
I've got some more questions about masks, but I do just want to sort of put a line under the mass gatherings quickly. If tomorrow you had to see, or let's say this weekend, you had to see the Soweto Derby, Chiefs vs Pirates at FNB Stadium, over 90,000 people, and you switched on your TV and you saw it, as an epidemiologist, would you immediately be concerned, or would you think that's okay?
No, I'd be quite comfortable as long as they ensure that the public transport getting there is the bigger concern than the actual match. No problem with the match. In an outdoor environment, 90,000, 100,000, no problem, no masks required. But I would be concerned about the way in which they got there and ensuring that the indoor spaces they move through, there was some mitigation of this, either through the very simple thing, just opening the windows, or ensuring that we have other steps to mitigate the potential risk there, like those who are elderly, for example, might want to voluntarily wear their masks.
Okay, now that makes sense. Thank you. So then face masks, and I mean, strangely, there's still debate. I mean, I'm slightly surprised that there's still debate over whether they work or not. But for someone with a comorbidity, someone who's elderly, someone who's going to be inside with other people, you might recommend that they should wear them.
So I'm a bit surprised that there are still some that don't understand the way in which masks work and the fact that the evidence points overwhelmingly that they work. So there was a paper just published that included an analysis of over 20 million individuals and looked at the risks associated and protection provided by masks. And this is across all 6 continents. And what they showed in these 92 countries that they studied, that masks consistently reduce the risk of transmission of the virus. And they do an overall calculation based on all of that data that it reduces the transmission by 19%. So in other words, it's not as good as vaccines, for example, but it does have an impact in reducing the spread by 1/5. Now, that is a benefit that we definitely want to have, but we'll need it when the cases are high. Right now, the number of cases we have in our country is quite low, and even if we have a big match, for example, the chances that there are positive people in there is very small. But when cases are rising, and when we are going into a wave, then the chances of a positive individual are high, and that's when we would want to use masks. So we've got to use masks more judiciously. There are times when they're going to be needed, and there are times when they don't really provide additional benefit when cases are low. So it's about adjusting and adapting to the waves in which this virus spreads in our country.
You're with SAFM, 18 minutes to 9, talking to Professor Salim Abdool Karim about all matters COVID as Cabinet meets today to discuss possibly dropping the final regulations. Professor, probably the biggest group of people who are wearing face masks on a regular basis indoors is school children. And I know that some of the science around the pandemic and the disease in children has changed just a little bit over the last couple of years. But it is probably they who are going to be mostly affected in the biggest possible way if the regulation is removed. You would be comfortable with that? 30 children in a classroom, no masks, so long as there's ventilation?
Yeah, so the way in which we have understood the sources of the way the virus has broken out and created waves, schools have played a very small, if any, role in that. We did some of those analyses in this country, and they've been done in many other settings. Schools actually don't really contribute to a large number of cases, even when we see small outbreaks in schools. And usually those small outbreaks occur because teachers or students acquired the virus outside the school setting and then spread it indoors. But even there, the spread has been very small and contained. We've not seen outbreaks occur as a result of transmission in schools. So there is no reason especially because cases are low at this point, and that's quite an important issue because we've got to learn not simply to live with this virus, but we've got to learn to live smartly with this virus. We've got to know when the risk is raised and when the risk is low. The risk right now for the next 3 or so months is going to be low. This is a good time to ease the restriction because the chance that there'll be somebody positive in the school is small. So no problem at all with school children removing those masks.
We need to talk now about the future of COVID-19, and this gets quite complicated. Let me start with one question that came to mind. If we're going to live with COVID over the longer term, there may be people who have gone through this stage of the pandemic, so let's just, for argument's sake, the last 2 years, without a comorbidity. So they haven't been at serious risk of the disease. But if the disease is going to stay with us for a while, if, for example, in 3 years' time they're diagnosed with diabetes, they could now have a comorbidity, the underlying condition. Is this something we need to be a little careful about, that the longer we have the disease with us, the more people could be diagnosed with underlying conditions over time? In other words, this is one of those things we still need to be very aware of as our own health changes through our lives.
Yes, I think it's an important feature of how we've got to think about the future. But I need to explain that the situation today is different from what we were concerned about a year ago. So a year ago, our main concern was, is somebody who gets infected going to require oxygen, going to require hospitalization, ventilation, and their risk of dying. So we were most concerned a year ago about the acute illness, the initial illness. Now we have a better understanding that actually we have to worry about the long-term consequences of infection, not just the acute infection. Because in the acute infection, the risk of hospitalization, especially in younger individuals, is low. But the risk of long-term consequences, even if you're young, even if you have asymptomatic infection or very mild infection, the risk of getting long COVID is our big problem. It's estimated that somewhere between 10 and 20% of individuals may get long COVID. But it's not only long COVID that we are concerned about. Now that we've been living with this pandemic for the last 2.5 years, there is new data emerging. And in the last 3 months, there have been a slew of studies that are showing us the long-term consequences. I'll give you 3 quick examples. The first is a large study that showed that 1 year after infection, whether you had the infection with symptoms or without symptoms, the risk of heart disease is now 50% higher. That's the risk of myocarditis, the risk of heart attacks, and the risk of stroke. The second paper was published in The Lancet. That paper showed that the risk of diabetes is now much higher if you've had COVID infection. Why? Because the cells in the body that produce insulin, those cells, the beta cells of the pancreas, they have the ACE2 receptor which the virus infects. So we now are beginning to see more and more individuals who had COVID developing early stages of diabetes. And the third paper, the one that really concerned me, comes from the UK, published in the journal Nature. They showed that in individuals who had COVID, most of them didn't even know they had COVID because they had it asymptomatically. The individuals who had COVID, their brain size diminished. Now that's a real concern because not only did they lose up to about 2% of their gray matter, what it showed was that they had greater difficulty with complex tasks.
Sure.
Now, it's these long-term consequences we have to worry about. So we need to protect and prevent every infection because without preventing those infections, we're raising this risk that in the long term we're going to see all these consequences.
So you can lose brain function. You can lose, I don't want to say lose intelligence, but I mean lose the ability to perform complex tasks because of COVID.
Absolutely. So this is an interesting study. So in the UK, they follow several thousand individuals on a regular basis. Every 6 months, they have a brain scan. And this is just part of a long-term study. And what they showed is in about 400 of those patients, between the brain scans, they had COVID. And they compared them to a similar group of the same age who did not get COVID in that 6-month period. And what they showed in this, that the brain scans were showing that actually those people who had COVID, their brains shrunk. Now, that's a concern. Now, remember that this virus is not just a respiratory virus. This virus affects our body literally from head to toe. It causes stroke because of the clotting that it's associated with. So it's the long-term concerns that we now have to factor in. So we need to be doing everything we can to prevent infection.
I can't think of a stronger argument to continue with the vaccination process than that. I mean, this tells us how important it is to, despite what's happening, to keep up the vaccination process.
Absolutely. And so vaccines do many things. And, the 5 key things they do are really, really important as we think about how we're going to move forward in living in the midst of this pandemic. So besides the fact that vaccines reduce the risk of asymptomatic infection, reduce the risk of clinical infection, reduce the risk of severe infection and death. So those are 3 big benefits. It does 2 other things. The fourth benefit is that there's now emerging evidence that it reduces the risk of long COVID. So now it reduces the risk of all these things I just described, the malaise and the loss of smell and so on. And then the first thing, and for me the most important, is the community benefit of vaccines. So there are 2 studies that really provide compelling evidence, one in the journal Science and the other in the New England Journal of Medicine. So the one in the New England Journal of Medicine shows that in following up 150,000 individuals who were exposed to infected people, they showed that if the individuals that were in contact with somebody who was infected but vaccinated, they were 68% lower risk of getting infected. So when somebody is vaccinated, they're actually protecting the other people in their homes, in their work offices, the people they travel with in public transport. So the benefits of vaccines are very significant.
Professor, thank you very much indeed. Do appreciate it. So, Professor Salim Abdool Karim with us through until 9 o'clock. I did not know about the impact on brain. We've got more questions for you, Prof, about what is happening with COVID-19 and the future of COVID-19 in your mediator conversation this morning, 8 minutes to 9.
SAFM.